All right, so we're here with ALiEM Book Club, and the book we're discussing today is And the Band Played On by Randy Schultz. So this book was actually suggested to me by someone I met recently at University of Nevada, Las Vegas Medical School, and they had spent time doing healing work with AIDS patients during the years of the epidemic. And I told her that I run this book club, and she suggested that this book would just be perfect for a book club and it's a must read. And I became interested in it. So when I first picked up the book, I realized, wow, this is a long book, 600 pages, a lot longer than our usual book club reads. But it actually, to me, read like a narrative, read like a story, although it was really a recollection of a lot of key players and events. Randy Schultz was actually a journalist who covered the AIDS epidemic during that period and then created this book, which I just thought was so well written, and it was actually a pleasurable read and extremely informative. So I would like to open it up to Aimee and Debra, who joined us today, about what interests them in reading this book and why they joined us, and what resonated with them while they read the book.
Hi, I'm Aimee Walsh. I initially read this book about 10 years ago. I read it while I was living in Tanzania. A friend of mine who had worked a lot more with patients with HIV had recommended it to me. And at that time, it really grabbed me because I feel like I was born in 1982, and so I have no recollection of the early HIV/AIDS epidemic. And it my first memory involving HIV/AIDS was when my mom checked out the Magic Johnson AIDS book from the library and was like, here, you need to read this and learn about it. And that was sometime in like the early to mid 90s. And so it was really interesting to think about just kind of how politics and health intersect, because I think a lot of times we sort of like to imagine ourselves above the fray as far as that goes. And then just to see how clearly politics impacted the pursuit of this illness was fascinating to me. Coming back to reread it again, I was actually surprised how fresh it seemed rereading it and how little of it I remembered from the first time. But what I was really interested in this time around rereading it was sort of thinking about how different HIV/AIDS looks now than it did 30 years ago, and how it's very much viewed as kind of a chronic illness and not this terminal diagnosis, but also just kind of the populations that are most vulnerable to it, and how that picture looks different, and how much race plays a role in that, and how much race plays a role in which activists were recognized for their work in the early AIDS epidemic. And so those were a few things that kind of jumped out at me initially.
Okay, I just realized I wasn't unmuted. I'm Debra Rose. I'm a second-year med student. And I'm really excited to be a part of this discussion because this book was such an incredible read. And I was interested in reading it because I realized that I hadn't known that much about the history of the AIDS epidemic in terms of all of the arenas that Randy Schultz touched on. So medical, he talked about the social aspect and the political aspect of the epidemic. And it was such an incredibly written narrative of all of these aspects that played a role in the unfolding of this endemic in the United States, as well as across the globe. I mean, he talked about how AIDS really arose in France and different parts of Africa, but of course there was a primary focus on the United States. And so there were just so many things that stuck out. I'm not sure if I can really, I guess one of the biggest things was the fact that there was quite a bit of hesitancy on part of the federal government to really take a lead role in addressing this epidemic in the earlier years, because it had just taken so long for the government to put funds into figuring out where this disease came from, what even formed the basis of it. There wasn't even that much knowledge about the specific microbe that led to AIDS. And so there was just a lot of hesitancy to put funding into looking for the cause of the disease as well as treatments, mainly because this was a disease that affected primarily the homosexual community. But then later, of course, we realized that other social groups were affected, drug addicts. We realized that also a large number of Haitians were also affected, children of drug addicts. And so this was not just a disease that affected the gay community. Many other people were also hit by it. And so that was probably the most jarring thing that I took from the book, the fact that the federal government had taken so long to really step up and make this a priority so that so many lives wouldn't be lost.
Yeah, I agree. I think that the most stark thing in the book is his tally kind of at the end of like a 6-month block or a year, where he's kind of saying at this point, 1,000 people had been diagnosed and 500 people had died. And then you kind of go to the next year and it's like, 4,000 people. And you can just see it kind of unfolding, and and I think the other thing that really struck me was just kind of how the people who had the foresight on this and really saw what was coming and recognized it as the tip of the iceberg, and that they were just sort of poo-pooed both in the political community and the medical community as sort of alarmists and kind of fringe wackos, and then end up being the people who kind of could have really made a huge impact if they were given the opportunity to.
Aimee, you brought this up also in your post, and when you were just talking how I think we're a younger group in this discussion, obviously, and come from a certain perspective where we know where AIDS went and how tragic it was, and that they didn't have that vision early on. But there were so many warning signs that many were going to die, and only more were going to die from this disease. And yet the treatment, the money, the research was so delayed for so many factors. It wasn't just one thing. It just was so many. Even the gay community themselves were divided on how they wanted to address this and handle this. And then you had the political platform at the time, and then the medical funding was lacking. I just remember I grew up in New York City. I was born in '81, so around the same time as Aimee, and just growing up knowing that it was this very terrifying disease, and not really knowing much about how it was transmitted, how you can get it. And then by the time I was applying to medical school, what I knew of HIV/AIDS patients was that they should outlive. This isn't a reason why they are going to die. And there's no reason to be worried about contracting the disease and caring for these patients. So a much different era where by the time I was even in residency, I remember counseling patients who actually have HIV and telling them why it's so important for them to take their medications, because this is not a disease that they will die from. So just a completely different reflection that we have today, perspective that we have today than we would have if we were beginning our practice in the 1980s. And actually, I think I was just wondering if you guys had thoughts on, if you were to enter medicine during that time, who would you be in the medical field during that time period?
It's interesting because so I was born in the early 90s, and I personally I didn't know anyone with the disease, and I still haven't met anyone with the disease. Much of what I learned about AIDS was actually through school, in the media, through what I'd read. And so I never really had any personal contact with the disease, which was another big reason or big motivator for me to read the book and to learn more about it. But if I had been working as a physician during the time of the epidemic, I honestly, I can't really say what exactly, or I guess which physician within the book I feel that I can best embody in character, but I would very much like to be like the early investigators in the CDC who were so passionate about getting to the bottom of this epidemic and about pushing the government, pushing those in the blood bank industry to step forward and to take a look at the evidence that they'd found about transfusion, about AIDS being able to be transmitted through transfusions, different things like that. I think their fire and their passion was so inspiring. And certainly if I had been alive during this epidemic and I'd been working as a physician during that time, I can see myself, I would love to be working alongside these individuals who are just so, who are so focused on developing or figuring out what the origin of the disease was and really trying to get many more hands on deck to tackling this epidemic.
Yeah, I think for me, you know, it's always so easy to say sort of in hindsight what you would do and hard to know in actuality when you're faced with something that's potentially, you know, a terminal disease, how you would respond. But for me, the doctors whose actions really spoke the most to me were like Dr. Conant and Dr. Volberding, because they were doing a lot of the clinical work, but they were also really focused on advocacy and creating that AIDS Foundation, as well as, you know, that when they started seeing that the funding wasn't forthcoming, that they kind of took that big professional risk of the end around the University of California system to try to get the funding and kind of deal with the consequences of that after the fact. And those were kind of, I feel like those are the ways that I work better. You know, I'm not a really like research-minded person necessarily. I'd be much more successful in kind of the advocacy and connecting people and social services and things like that as kind of where I feel like I fit in better. Yeah.
No, I think I would, while I was reading it, I think about these doctors who are on the front lines or nurses just treating patients that they know these are terminal and there's a disease that has a horrible mortality, morbidity, with so much unknown on how this is transmitted, and yet they were so brave to be able to care for these patients at that time. That really resonated with me a lot while reading this book, and kind of how fortunate we are now that we're not really faced with that situation coming into our work every day. But, you know, this isn't something that anyone predicts or wishes, obviously, and how do we plan for the next event like this? How do we prepare ourselves to be leaders as physicians, and what would we expect from our political leadership as well?
Yeah, so backtracking a little bit, I thought of one more thing kind of related to your previous question that sort of relates to this one a little bit too, is, you know, in emergency medicine, I think that we're sort of uniquely positioned sort of both advantageously and disadvantageously. Like, it's an advantage and disadvantage to be an emergency in this, because you're going to be kind of the canary in the coal mine, so to speak, as far as seeing the first patients with opportunistic infections, if this were the case. But on the other hand, it can be so much harder to connect those dots because you don't have the continuity of care, and you only know about the cases you're seeing while you're working, and not necessarily connecting the cases that your colleagues are seeing or whatever. And I'm sorry, now I'm blanking on your previous question. Oh, I'm not getting your sound. You're still muted.
Yeah, sorry. How do we prepare ourselves for what really did we learn from this? This is, I think, in a lot of ways, a lesson on how we can prepare for the future. So how can we best prepare ourselves for a future epidemic and crisis like AIDS?
Yeah. Well, and that was one thing that really struck me reading this book was how I think your friend Anjali's email kind of referred to this as well, of just how many of the lessons from the early AIDS epidemic haven't really been heard. And I think you can see that most recently with Zika and the big struggle that researchers had in trying to secure research funding for Zika, that system still isn't there for us to have sort of an emergency research and treatment, like just kind of a specific pathway that you can go down that doesn't have all of the formalistic, we want to have the scientific rigor for this research and for others, but we need to have a way to make it go faster. So like, for example, one article that I read recently that I thought was really interesting talked about how as they were thinking about how to do Ebola vaccine trials, that it just wouldn't be ethical really to just have your control arm and your experimental arm, because then you're just kind of basically telling these people in the control arm, like, sorry, you're out of luck. And so what they were doing was, because there were more patients than there was vaccine, they were just kind of having the people that they couldn't yet vaccinate be the control arm as they were rolling out the vaccine. And so I think that, I think it does take sort of looking back at kind of creative solutions like that and extrapolating, but also having an emergency pandemic response where we don't have, a 6-month-long request for proposals before we release research money and things along those lines.
What I was most shocked with at one point in the book was where they could not release data because it was going to be published in a journal in 5 months. Mm-hmm. And as a consequence, people will die because we just won't share information. And just coming from this new age of FOAMed where we release information so quickly and we're willing to share and people have access to so much more information and data, hopefully I think that it's, in some ways will help us in a future event like this, that there is more sharing of data and we realize how important that is.
And I think the other thing that I think about too is sort of how we as clinicians and researchers can communicate better with the media to get them sort of on the case of raising public awareness about these diseases too, because Randy Schultz talks explicitly about how, when this was just a disease of gays and drug addicts, the media wasn't interested because their readership wasn't interested, and sort of like, how do we as clinicians make everyone get interested in this disease? And, to a certain extent, I kind of feel like it's like that headline that's been going around recently of like, I just don't know how to convince you that it's important to care about other people. But I do think that healthcare providers in general, particularly over the last year or so, but just in general over the last 3 to 5 years, have gotten a lot more outspoken on political issues and writing op-eds and kind of getting out there as far as the importance of these health issues. And I think that's an advantage as well. But it also is kind of, it seems like these kind of crises are always sort of like come out of sort of the unique societal blind spots of their time. And so it always can be hard to, maybe we kind of confront the barrier that led to AIDS. But that was one thing I was thinking about as I was reading this book too, was sort of like, who are the people that are who are our kind of next people who are really vulnerable because we just don't care enough about them right now.
Yeah, I think that's a really great point. And I'm so happy to see that the culture in general of medicine and public health is changing, because we're seeing more and more that physicians are, I mean, it sounds very simplistic, but it makes a world of difference that physicians are listening more. And studies show that when you have, when doctors are more empathetic, more understanding of patients and a particular lifestyle, a particular experience, their culture, that obviously plays a very big role in disease. Studies show that patients are more likely to be compliant, they're more likely to listen, they're more likely to have greater adherence. And so I think that was a big part of that played a big role in the outbreak during the 80s. And I guess a big reason why researchers and politicians were not able to control the outbreak as they could have if there had just been more compassion, more understanding. It's very simple, I guess, behavioral traits that we teach little kids about all the time, but it makes a world of a difference on a bigger level. And in issues like this, it's so important to really just kind of take a step back, put money aside for a moment, and think about the lives that are being affected in epidemics like this. It's just so important to just really put value to lives that are being lost at an alarming rate, like in this epidemic that we're currently talking about. So it's, again, very, very simplistic things that we learn when we're young, to listen and to really take a step back, empathize with others, be willing to put our own feet in the shoes of other people to understand what they're going through. And I think that speaks volumes and really propels professionals forward, healthcare professionals. I guess we can say specifically for physicians, that's so important in helping patients adhere and comply. And it's also very important in the first steps of tackling an epidemic such as this.
Yeah, Aimee, that's a very good point. And I like that idea of going back to what are our reasons for becoming physicians. I think most of us choose this field of work for those reasons that Debra mentioned: to listen, to be empathetic, to truly care. And I think that changes for many of us as we get involved in the system, and there's other factors that we come into play as we begin our own practices. Just reading through Aimee's she wrote many good questions on her blog post. And I'm wondering, Aimee, do you want to pick one or two questions for us that you'd like to hear us answer?
Sure, let me see if I can pull those up here. I think one of the ones that I was really interested in was at one point, I think it was Paul Popham, when they had their initial fundraiser on Fire Island, and everyone was just so mad at them for having this fundraiser. And just, he was kind of reflecting to himself about, like, how do you help a community that doesn't want to help itself? And I think that, you know, I don't know that we necessarily see this as much on a community level as a whole in our ED practice, but I think, you know, on an individual level, we see this all the time of working with patients who you're just like, how do you reach someone when they just aren't ready to hear what you're saying, or things like that. So that's, I think that one. And then, oh, what was the other one I was thinking of? We'll come back to that later.
I'm thinking for, yeah, I like that question. First of all, it kind of makes this book applicable to something that we might deal with every day, and just similar frustrations that I think we face as physicians to what some of these leaders were facing in the communities that they were trying to lead. But I definitely think that is one of the bigger struggles of being a physician sometimes. I'm not sure if I handle it well or how I handle it. I think we need to believe in what we do and do our best to educate people and try to guide them in the right direction, but you can't always do that. And many of the leaders that were discussed in this book face so much opposition that you could really feel how crazy they must feel when they see the picture clearly, and they can't get the support that they needed. And that's just been shown in so many other historical innovations and important research that's changed the way we practice medicine. History's shown us that they tend to be voices that are really alone, and it's very lonely to sometimes be a leader. And maybe that's something that we also face as physicians sometimes.
One other thing I was thinking about a lot was another quote from the book that was talking about don't offend the gays and don't inflame the homophobes. These were the twin horns on which the handling of the epidemic would be torn in the first days of the epidemic. And so I was thinking about, like, you know, after that, sort of what the consequences of having a more direct approach to the disease would have been. You know, I think that, you know, overall, it probably would have been for the best as far as getting people out of the bathhouses and things like that. But I also was kind of imagining, you know, if they had about this, you know, one of the things that they were afraid of was sort of creating a sense of hysteria. And, you know, if you do look at diseases like Ebola and things like that, you do see that it can kind of swing the other way too. Like, I was in Uganda at the time that Ebola cases were really starting to ramp up. And a lot of my family and friends were like, don't get Ebola. And everyone was like freaking out about it. And I was like, I am basically as far away from anyone with Ebola as you are, you know, and that there's just kind of this alarmism, and that can also kind of lead to its own consequences and lack of connection, lack of compassion, and things like that as well.
It's just like such a tough position that I think they were faced with here they had made so much stride in their civil rights and their community, and now to feel like it was going to be all taken away from them because of something that seemed unknown at the time. Like, when you're reading, because we know the end, as I'm reading it, I was so frustrated with what was being allowed to continue and to happen. But being able to understand that other perspective as well is also really important.
There was a lot of hysteria surrounding the disease, obviously. I mean, like you mentioned, Jordana, we know the end now. And so reading about what was developing in the early stages of the disease was quite frustrating because we knew exactly, we know what the virus is, we know how it acts, we know how it spreads, but there was a lot of uncertainty, of course, surrounding that during the early years as researchers tried to figure this out. And so because there was a lot of uncertainty, there was a lot of hysteria, the public was erupting. I think that there was already quite a bit of stigma against the gay community, of course, and so this disease exacerbated that stigma, as well as stigma towards other social groups that were affected by this disease, and even certain ethnic groups like Haitians were, I remember reading that there were quite a few of them who weren't able to get jobs because the CDC had listed them as a risk group, which we know now today is that is completely inappropriate, and so they were taken down as a risk group. But we know today that these things, we know the origin of the disease. We know how it should have been handled. So I completely understand that sentiment of frustration while reading about all these things that were allowed to go on when they should have been ceased.
Yeah, so I think we're going to try to wrap it up. So any concluding thoughts or comments that you want to put out before we end for today?
One last thing from the book that I think is interesting to reflect on now, 30 years after the book was written, is that Randy Schultz really kind of villainized, I'm going to totally massacre his name, but I think it was like Gaëtan Dugas. It's really interesting to look back on that now. You know, I think part of it is that he was trying to use him just to sort of exemplify a problem of people who have the diagnosis just being really cavalier about spreading the disease to others. But in kind of calling him patient zero and things like that, it almost makes it sound like he was the one who brought AIDS to the US and that. And it's interesting now to look back on that. They actually found that HIV arrived in the US, I think it was like in 1971, so a lot earlier than Randy Schultz thought that it had come based on his research. I think he thought it was around 1976. And I just, you know, I think I get that it was to illustrate a point, but at the same time, it just, knowing what we know now about that, it's just uncomfortable to kind of have this person that was sort of, I don't know, almost slandered to make that point of something that he certainly wasn't unique in doing, although it did have a big impact on the spread of the disease.
I think that's also good criticism of the book, perhaps, like maybe, you know, to question some of the accuracy of the information and what's missing. And that was maybe some missing pieces. I liked, Aimee, also that you wrote about the author at the end of your blog post and talked about how he was also gay and knew many people affected by this. So there's definitely a personal connection for him reading it, and maybe that played a part of how maybe there was some emotional background in there too of how he felt about certain characters. And then that you mentioned too that he waited to find out if he knew that there was a likely chance that he also was infected, but waited to get tested until after completing this book so it wouldn't affect how he wrote the book. So I think at the same time he did what he could to be unbiased in creating and retelling the story.
Yeah, one thing I found out as I was learning a little bit more about him to write the summary was that he was actually born in the same town that I was born in. So it was just kind of an interesting coincidence that, I don't know, made me feel a little more connected to him. So.
Debra, anything else before we wrap up?
I think we talked about all the important points. No, I want to thank you for allowing me to be in on this discussion. This was an incredible book, and I'm so glad I read it. You know, to be honest, before I started reading it, I saw how thick it was, and it was a little intimidating. But I'm glad I persevered and read through it because it gave such a thorough account of the history of this epidemic. And quite honestly, I think that every physician should read this book. And yeah, thank you for suggesting it. This is a great discussion.
Yeah, and thank you both so much for participating. I know there were some other people who wanted to join today and couldn't join us. And I was glad to see that there was enough interest and people were actually reading this book because yes, it was longer than some of the other books we read. But some books, I've talked to Nikita about this too, that there's just some books that are worth reading and they're going to be longer. So we will have some of those throughout the year. And it's just been really nice to have this discussion with you guys. And hopefully people who couldn't join us will be able to comment on the blog post too. And I look forward to doing other book discussions with you guys in the future.
Great, thank you.
Thank you, same to you. Thank you.